Hello, and welcome to the Miller Chiropractic Minute. My name is Dr. Trevor Miller. I'm in North Vernon, Indiana, and I'm going to be doing some patient education. I have a lot of questions that patients have asked me, and I'm going to take this time to actually post them to our Miller Chiropractic Clinic Facebook account. And any questions you have, you can contact us there at Miller Chiropractic Clinic on Facebook, and I'll be happy to answer them. So, first thing I want to talk about is something that a lot of people have and are going through and they don't realize it, and it's called disc degeneration. So, if we look at this disc, this model of a spine, we see right here this soft spongy material. Well, the disc is actually made of two different types of material. We have the soft inner core, which is called the nucleus propulsus, which has the same properties as jello. Then on the outside, you have a very tough fibrous, like a burlap. And that burlap has fibers that run this way, and then this way, and then this way, and they form a mesh going all the way back. Well, over time, if you lose the normal curve in the spine, what happens is that straightens out and that pushes on the disc material here, allowing the jello to squirt out towards the back sides of it. And as that happens, then the disc gets thinner and thinner, and that jello will shoot out and hit the nerves here. Another model that we have is right here, and that shows where the disc bulge itself is coming out and hitting the nerve root. When that happens down low, down in here at L3, 4, and 5, what you have is you're hitting the lumbar plexus, and as the lumbar plexus comes out and goes around, you start to get pain down the buttocks and in the back of the leg, and that's known as sciatica. So as the disc wears out, as the disc gets pressure on it, and that starts to happen, then what happens is the nucleus propulsus shoots out towards the back, goes into the spinal canal, starts to put pressure on the nerves. That's why you can cough or you can sneeze or do something of that nature and you feel the pressure. Or if you're jumping up and down, you have a disc bulge. The thing is, when you first feel those are very treatable, I should say, by anti-inflammatories, and that's when people usually come into the medical doctor and they will get anti-inflammatory meds, and that will help take the inflammation down. The problem is if you don't take care of the spine straightening or the posture, then that continues to wear on that, and then eventually what happens is the disc starts to thin. As that disc starts to thin, it can't come back. Once it's gone, it's gone. So what we need to do is get in on that while you're taking the anti-inflammatories and start to move that so it opens back up. Then that will take the pressure and the pain out of the back of the buttocks and down the back of the leg, allowing you to feel better. Thank you for your time, and if you have any questions, don't forget to email us. You can email me directly at indianabackdoc@comcast.net, but the easiest way to get a hold of us is actually on Facebook. We have somebody monitoring it all the time, and that is Miller Chiropractic Clinic. Once again, have a good evening, be healthy, have fun, and live life to the fullest.